Hi, my name is Aleem. I'm an emergency physician here at the Hamilton Health Sciences, and I'm the physician site lead for the Hamilton General Emergency Department. We're standing here in front of the Hamilton General Emerge, and we're going to go through the department and talk about how we are managing to keep patients and staff safe during COVID-19. One of the things that we're finding is that people are delaying coming into the emergency department, not only for potential COVID symptoms, but also for other things like chest pain, shortness of breath, abdominal pain. One of the challenges with that is that we do sometimes find that if people delay coming in, the disease, whatever it is, has progressed. So something that could have been managed relatively easily early on is actually much harder to deal with or much more complicated to deal with later on in the disease course. So we would certainly encourage people to come in when they have symptoms and when they're worried, as opposed to delaying into later into the disease course. This is your first stop when you get into the emergency department. The first thing that'll happen is you'll stop at a screening booth where they'll ask you a few questions about what types of symptoms that you're having, specifically if you have symptoms like fever, a new cough, new shortness of breath, you've traveled anywhere, and you'll also wash your hands and you'll receive a mask before you proceed to check into the emergency department. So part of the reason for giving a mask is that although we would love to bring everyone immediately, sometimes there is a little bit of waiting before you're able to come into the emergency department. So what we give is we give you a mask. The mask serves two purposes. One is it's to protect you from getting viruses from other people who may be sitting in the waiting room with you, and also it's to protect others. The mask actually acts as a fairly good barrier of preventing viruses from leaving you and infecting others. We also are trying to ensure some degree of distancing within the emergency department waiting room to ensure that people are not spreading infections amongst themselves. In addition to our regular cleaning, because we already do clean areas between patients, if there is a patient who screens positive for COVID with COVID-like symptoms, that room does undergo more thorough cleaning to ensure that there's no virus left behind for the next patient using that room. Most importantly, we want to encourage people to not delay coming into the hospital if they're feeling unwell. In particular, if you're having chest pain, shortness of breath, you or a loved one is being difficult to rouse or has a loss of consciousness, weakness, or difficulty speaking, please come to the hospital or call 911. The emergency departments in Hamilton are safe, and we are here to provide care for you when you need it. One of the other things that you can always check is you are able to check emergency department wait times online. It's on the website noted below. You can actually just go on there and see what the wait times are at all of the emergency departments and urgent cares in the city.